Hello, viewers, welcome and welcome back to the channel of Nursing Edge. So, we will be knowing about back technique. All of you must have heard about back technique. Okay, it comes in the subject community health nursing, and it is one of the important question that is compulsorily asked in the exams as well as competitive exams. So, back technique is that question that comes 100% in your examinations. So let's see what is back technique in detail so that you can answer it without any difficulty. Okay, so first of all we will be doing the introduction that what is basically a back technique. So back technique refers to the practice of carrying and handling medical supplies in a way that prevents contamination. So back technique एक तरीके की ऐसी टेक्निक होती है जिसमें basically what we are providing healthcare facilities to the people of urban areas that live far away from the hospitals, so we have to go to their place. So that is why we carry a bag that carries all the essential medical supplies that will be needed there, and we have to carry them in a bag so that we can prevent it from contamination. So whenever we will be providing the health facilities at the community level or their homes, we will not be transferring infection to them. Okay, so that is a definition of bag technique. So it is a specialized technique of handling the medical supplies so that they can't be infected by the bacteria or any pathogen, so that we cannot pass it to the individuals who to whom we are giving the medical care. So next is what is the importance of the back technique. So back technique is essential for maintaining hygiene, preventing infections and promoting safe patient care. Okay, so what will be the purpose? So the purpose will be to ensure the sterile equipment remains sterile. Okay, it means if we are keeping a sterile equipment, sterile means which is free from pathogens. So if we are keeping the sterile component, sterile equipment, so back techniques ensures that the sterile equipments remain sterile. It means it will not be contaminated, and non-sterile items that are full of pathogens are can handled carefully. So now what will be the principles of back technique? So first principle will be cleanliness. It means we have to maintain a clean environment. Now separation means sterile items should be kept separate from the non-sterile items, because sterile items can get the contamination from the non-sterile items, and if we will be giving care from that particular sterile equipment which is now contaminated, so we will be passing the pathogens to the patient, so we will be passing the infection to the patient, and that doesn't come in the nursing care. Next is protection. So in protection, the sterile field protection is needed. It means if the equipment is sterile, so it should be sterile. Next is the organization. Supply should be neatly organized, so we will be keeping that substances as we are what we will need first and second, and what is the least needed substance or equipment which should be placed at the last. Now there are some steps for bag technique. The first step is preparation, second is packing the supplies, third is handling the supplies, and fourth is disposal. What are the key components of bag technique? So bag techniques are having the key component. It means these substances, these equipment should be present in the bag. So the first thing is your sterile gloves that are must needed substance or component of the bag. Now the second thing is your sterile instruments. If you're going to provide the care at the doorstep of the individual or urban population, so you should be having sterile instruments so that you cannot or you would not pass the pathogens to the patient. Now third thing is clean environment. If you're giving care to the patient, you should choose a clean environment, and wherever you are giving the care, you should keep the area sterile. Next is waste disposal. In waste disposal, the environment should not get contaminated, and along with that the sterile equipment that you are using that becomes unsterile or non-sterile while using, or any other waste like cottons and other things, ampules or needles, syringes, used syringes especially, so they should be disposed according to the biodegradable waste management. BMW management should be done, and that pathogens should not be passed on to the patient's home or any other patient's hand or something, any else components. So the most important step is the waste disposal. The next component is challenges in the community health nursing. If we are talking about the back technique is usually used to provide the care at the doorstep of the patient that lives far away from the hospitals. So what are the challenges that a person faces? The first challenge is limited resources. Limited resources means there are lack of resources that we can carry to the patient's home, as like in the hospital we are having a variety of equipments available at a particular space, but when we go to provide care at the home or the doorstep of the patient, we can carry a limited resource there. So the first challenges is limited resources. We can't carry much items there, we can't carry much equipments there, so that is a challenge for the community health nurses to provide care. Next is environmental contamination. In hospitals we are having BMW disposal components where we can dispose the items of. We are having BMW dustbins at the hospitals, which are not frequently seen in any urban area. So environmental contamination is also a challenge if we are going and providing care to the patient. So we should provide the care in such a manner that it would not, or it should not contaminate the environment, so that if we will be giving treatment, then after some time the patient would get another infection. So that is the thing, that is a main challenge. Next is patient interaction, because mainly the rural population do not interact with anyone so easily, and they will not allow you very easily to give any kind of care to them, especially the medical treatment. They become suspicious of you, like. So patient interaction is one of the important challenges that a nurse faces at a community setting. So in back technique we are carrying a heavy bag on our back, and still people are not interested in talking to us like that, because if you're coming out from your institute, from your hospital or your center, they don't take you much seriously, so they avoid interacting with you, they don't share your problems as much. So these are the things that are a big challenge to the community. Now, infection control and safety measures while vac technique is, first is your hand hygiene. You should be maintaining hand hygiene. That is done by proper hand washing, and after that proper equipment handling. If you are having equipment that is sterile, so you should use it very properly, so that it will not, it should not be become contaminated, so that the pathogens will pass. Next is environmental controls. We should not touch any non-sterile component to the other spaces or the surroundings, so that should be maintained. And applications in community health, what is the back, if we are using back technique, where can we apply it? So we can apply it home visit. Home visit is when we go to the doorstep of the patient or a particular community to give healthcare, that is known as home visit. Next thing is health camps, that we are doing a camp in their particular area where the health facilities are taken to there. Now, family and community engagement, when we include the community to the protection or for the protection of a particular disease in a particular area, so we are using the community people for their benefit. So at that time we use the back techniques, we take the resources to them and show them what, how can they use it, or what are the uses, how can they diagnose a particular disease. So these are the applications. So now reaching to the conclusion, so the summary is back technique is essential for infection control in community settings, and key takeaways are Follow cleanliness. You have to maintain the cleanliness, separation, and non-sterile and sterile components should be kept separate, and protection principles so that the patient can't get any other infection from you. Now the third thing is call to action. It means encourage the nurses to practice and teach back techniques, as it is one of the most important techniques that are used in the community health settings. So thank you so much for watching. Do like, share, and subscribe. Hope you like the video, and if you are having any questions or queries, please drop them in the comment section. Thank you for watching.